Welcome to the deep dive. Today, we're really going straight for something huge, that unspoken fear around cancer, the fear of pain, that feeling that, serious suffering is just part of the deal.
And based on the oncology research we looked at, well, it's not necessarily true. Uncontrolled pain isn't inevitable. So our mission today is really practical. Give you, the caregiver, a clear path, kind of a shortcut to making a real difference.
Okay, a shortcut. I like that. And the research frames this around 3 key roles for the caregiver.
Exactly. You become the pain detective, the medication manager, and the commander of the comfort corps. 3 hats, really.
Let's start with detective work then. Making the pain visible, not just guessing. What's the first step?
It starts with a common language, the 0 to 10 pain scale. 1 to 3 is mild, noticeable, but you can function.
Right.
And 4 to 6, that's moderate, it's intrusive, hard to focus. And 7 to 10 is severe. It just takes over everything.
Okay, the scale makes sense. But the sources stressed that the number is just the start. The description is maybe even more important, like sharp versus dull versus burning.
Absolutely critical, because how it feels points to why it feels that way. If someone says burning or shooting, that screams nerve involvement to a doctor.
Ah, okay. And that needs different treatment than, say, a dull ache.
Totally different medications sometimes, so getting that description is key.
So the most practical tool for this detective work?
A pain journal. Simple, but powerful. You log the score, yes, but also that detailed description, what meds were taken, and this is really important, the score, again, maybe an hour later.
Got it. Turn subjective feelings into, well, usable data.
Exactly. Objective data for the medical team.
All right, so detective work done, journal in hand. Now we shift to managing it, the medication manager role. You mentioned a core principle, stay ahead of the pain.
Yes, because waiting until the pain is already a 7 or 8, you're fighting an uphill battle. It's much harder to bring it down.
So the goal is consistency, keeping it low, like a 2 or 3 around the clock.
Precisely. And that usually involves 2 types of meds. There's the long-acting one, that's your foundation, taken on a fixed schedule.
Okay.
And then the short-acting or breakthrough med, just for those times the pain spikes unexpectedly.
Let's talk side effects, specifically the big one with opioids, constipation. How certain is that, and what's the rule?
Well, it's pretty much guaranteed. It's not a maybe. So the rule is ironclad. Start a bowel regimen, like a softener or laxative, the same day the opioid starts.
Wow, okay. The same day. Don't wait.
Don't wait. You have to be proactive.
And quickly, the fear of addiction. The sources really wanted to separate physical dependence, which is expected, from actual addiction, which they said is rare in this context.
Very important distinction. Dependence is the body adapting. Addiction is a psychological craving. For legitimate cancer pain managed properly, addiction is not the common outcome. And remember, there is no prize for suffering unnecessarily.
No prize for suffering. Okay. So beyond meds, there's the comfort core, the drug-free stuff, like hot and cold packs. When do you use which?
Good question. Cold packs are generally better for localized, sharp pain, maybe inflammation, think like an acute injury. Heat is more for that dull, persistent muscle ache, stiffness. It relaxes things.
Makes sense. And breathing. How can that help during a pain wave?
It's surprisingly powerful. Guide them through slow, deep breaths. Maybe inhale for a count of 4, and really focus on extending the exhale, maybe to 6 counts. It calms the whole nervous system down.
Simple but effective. Plus other things like just changing position with pillows or distraction music, maybe a funny show.
Absolutely. Positioning prevents stiffness. Distraction gives the brain something else to focus on. Every little bit helps.
Okay, final rule. The advocate. Knowing when to escalate. When do you absolutely need to call the medical team?
Okay, crucial points here. Call immediately if the pain is new, or if it suddenly changes character, or if it moves somewhere else.
Right, that signals something different might be happening.
Exactly. Also, if that short-acting breakthrough medicine isn't giving relief within about an hour, and a big one, if you find you're needing that breakthrough medicine more than, say, 3 or 4 times in 24 hours.
Why is that last one so important?
Because it usually means the foundation, the long-acting dose, isn't strong enough anymore. It needs to be adjusted upwards by the team.
Got it. So wrapping this up, being an active caregiver in pain management isn't just about comfort. It sounds like it's about defending dignity, preserving their strength.
It truly is. You're easing a symptom, yes, but you're doing so much more for their overall well-being and spirit, which leads to maybe a final thought for you, the listener.
Yeah.
If we accept that managing pain well is one of the most vital things we can do for quality of life, what hidden strengths, what resilience might your loved one find in themselves once that constant static of pain is finally turned down?